Good morning. Welcome to the March GHA GDDS Strategic Planning User Group. Thank you for participating. My name is Leslie Stanovich. I'm the Senior Director of Data Services. I have Bill Wiley, our Senior Vice President over Business Operations, and Sharifa Navos, our Data Integrity Specialist, here in the room with me. And I'm actually going to turn most of the presentation over to them so I don't cough a lot on our call. But thank you again for participating, and we'll begin. Our agenda is fairly brief today, but again, this is your call, and there will be a time for questions. So this is an open forum for you to participate and ask questions about the Georgia Discharge Data System and our tools. As a brief overview of what the Georgia Discharge Data System looks like, hospitals submit their data to Heidi, who is our data partner, in the UB04 data format. That data is then run through a series of data checks and validations. Certain codes, GEO codes and DRG codes are assigned to that data. And then that data is given to GHA, and we distribute that on your behalf to the Brain and Spinal Trust Fund Commission, the state of Georgia, the Agency for Healthcare Research and Quality, and the Healthcare Cost and Utilization Project. Sharifa's briefly going to go over our schedule.
Yes, good morning. So this is the 2019 schedule where you're wrapping this up in terms of the submission. So the latest submission was for December, which was due last month. So if you, a few of you have reached out to me to let me know that you're having a few issues with that, and so we'll be communicating to make sure that your data is in. But until, I guess, July, you can resubmit all of 2019 with corrections. So I would suggest that you go through and look at your fatal error rate, make sure that it's below the 3% threshold so that you can resubmit, make corrections in your system, delete old files, and upload new ones. So you have until July to do that before we close 2019 for good. So that would be the final, as you can see on the schedule, the final release, or quarter 5 as we call it. And so if you have any questions about that, feel free to email me. And we also have the 2020 schedule.
Right, posted. Before we move on from the 2019, we did just receive the fourth quarter 2019 data set from Heidi. We will be distributing that for those of you who are limited data set subscribers later today. And then it also, Javion is working on publishing that, making it, integrating that into the visualization tool. So that should most likely be available later next week.
Thank you, Leslie. And yeah, for 2020, that's posted on the website under the GDDS resources. So if you go to the data tab under GDDS, you can see like the member resources, and we have those posted. And January is due in about 10 days, so on the 15th, we'll be processing that. So again, please make sure to submit your data and contact me if you have any issues.
Also, I'm going to unmute everyone, but please keep in mind that if you put us on hold or have sidebar conversations, unless your phone lines are muted, everyone else will be able to hear your conversation as well. So I've unmuted everyone, so please speak up if you have a question or a comment at any time.
Okay.
Keeps jumping around.
Just wanted to let you guys know that the invoices for 2020 GDDS went out this week. As you know, it's based on 2018 data, inpatient, ED, and AMSurge. AMSurge does include ED AMSurge, so that's based on that with the tiers. What we've got here in the next couple of slides, we've sent this to, if we did not have a contact person that we know has been doing this before, we've sent this to the CFO. a cover letter that explains what GDDS is, all the services that are around that. So if you start to get questions, just wanted to make sure you guys do that. We do have 100% of the acute care hospitals in Georgia, and also several border facilities. Some of them, generally speaking, their patients are out migrating to Georgia, and then a couple are migrating from Georgia. So it helps to give some of those extra context for those border facilities. This does, again, as we've talked about, it's in the letter, and it satisfies the mandatory state law reporting requirements. We're in the process of getting some more clarification on that, because we're not, we've had a fair number of specialty hospitals, psych hospitals especially, that have asked to report, and we suspect that they are required, but we're getting some more clarification on that. Did want to clear up, a lot of the folks will look at it and go, they're in the HIDE program, but HIDE is, as we've talked about and all you guys know, is our subcontractor that does the work. So I wanted to make sure that all of y'all knew that. The next slide we have we gave just in the cover letter, just some things that they can do with the data, the market share, sort of payer age class, things like that, stuff that you guys know, but we wanted to make sure that you are aware this information also went out to the CFOs, and if it did not come directly to you, just to make sure you guys are in that loop. We have a question? Oh, okay, just a chat. We'll get to the next slide.
Apparently I have to click it twice to make it work. Okay, there you go.
Yeah, just some more information on the fact that, you know, we supply the secure online software. We talked about the readmission module. We have a fair number of hospitals using that readmission module, but wanted to make sure that you guys were aware too. That's available to anything. It was started with money from a grant for rural hospitals, but that is available for free for every hospital. It helps hospitals understand where their readmissions are coming from. We're able to use the longitudinal ID that we have with the patient records to track whether they went from one facility to the other. So that is there, and it's free for any hospital to participate in. You can drill down to the individual patient record to understand which ones were the readmissions or not. As we've talked about before, it's not really a judgment on whether it was a planned or unplanned readmission. It was just, hey, that person showed back up at a hospital 30 days later. The data in there, since Sharif has been doing such a good job of identifying all those different sources, I think the data is a lot cleaner. We've got a lot of folks that are submitting that data more appropriately. It's better identifying the swing beds in the psych facility, so it's not showing up as excess readmissions when they were really just going to another, quote, inpatient area. Yeah, we've kind of talked through that. And then we also referenced the data services folder that's also part of your subscription. That's where we do a lot of the modeling of all of the different, the new regulations coming out, updated OPPS and inpatient prospective payment rules. A couple more that we've actually posted in the last couple of days. So all of that was included as part of the cover letter that went out with the actual invoices. That if you have not gotten one, let us know. We can tell you who it went to in your organization. If it should come to you, let us know. We've got some hospitals where we have 4 or 5 different contacts for the data program in general, and none of them are listed as a primary billing contact. So if we need to update our records, just let me, Leslie, or Sharifa know, and we'll get that handled.
And I just received a chat that there was some background noise, so I've muted everyone again. We'll pause in a few minutes, and I'll unmute everybody right now, and if anybody has a question, please, everybody's unmuted again now. Does anyone have any questions or feedback? All right, I'm going to mute everyone again because I'm still hearing a little bit of that background noise, and let Sharifa talk to us about the new HIDE-Net submission portal.
Yeah, so for the data uploaders, I don't know if you've, I think you should have received the email maybe a month ago regarding this, this new version of HIDE. So it's the new version of the website where you upload the data. A lot of you, well, a few of you have emailed me telling me that you didn't receive the activation email. So if you could check your spam or junk folders, you should have received it between the January 13th and 21st. So that week is when it was sent to everybody, all the users, and also we've, you know, we've received new users and users to remove. So we've been able to update that user list. So if you have not received that email, please contact me so that we can finalize that. The old website will not be available for much longer because some of you have been using it, you know, maybe not knowing that the new website was available. So please let us know. And it should, you know, it changed a little bit, I guess, visually. So it's like a blue, I have some screenshots here. So the activation email is that blue email, and then the home page where you sign in would be that HIDE logo. It's not green, it's blue. So if you, you know, if you haven't gotten it, let me know, and then make sure you let me know, and don't click the forgot password link because then it'll go to HIDE and it'll come back to me. We're trying to handle it here and then send it to HIDE. That's it for that. And again, email me about your vendor updates for your electronic medical records, any new users that you would like to add to any sites, and any old users that need to be removed. This is a reminder to email us so that we can keep our list of users clean and we can send email notifications to the right people. Does anyone have any questions?
Yeah, let me jump in on that. This actually came up yesterday down at the Capitol with some of our GR folks. Apparently someone, I don't know if it was in the House or Senate, were asking about doing a survey, or how hospitals were going to have to report whether or not they met a meaningful use standard that is going to be slightly different from the one that we are already having to report to CMS. Our position was it was very duplicative of what was going on and why change the definition. But one of the things that they were asking us is how onerous that survey would be. Just kind of a quick verbal, is everyone with the vendor platform that they're using now meeting meaningful use, able to submit kind of the real-time, or if not real-time, patient data back and forth to other providers and folks like that? That we're trying to obviously understand why they're asking this question, why they're doing this survey, and they're trying to tie it in as part of a CON application in Medicaid reimbursement. So, Leslie, if you can just knock folks off of mute. All right, so.
Unless you've muted yourself,
yeah.
I've unmuted all the phone lines.
Give me a quick idea of how many, if we are all, you think everyone's meeting meaningful use, and if they did do a survey, how onerous would that be for you guys to report that? Don't everyone speak at once, please. I mean, if it's going to be easy to do, then we won't waste a whole lot of legislative effort and time trying to fight something.
Or if you're too shy to speak up, I'm monitoring the chat box. If you'd like to chat, send a chat in.
All right, well, it sounds like it wouldn't be, judging from the response, I would assume it's not going to be too hard for hospitals to attest to that, depending again on what the survey is. Okay, well, I'll jump to the reports that we just uploaded and submitted out last week. There are some new ones that we've posted. I'll start with the quality folders right now because we'll ask a question on the finance ones. 3 of them that we just posted, they're all based on fourth quarter HCRIS data from 2019. It's the earliest we can get. And they're all related to the federal fiscal year 2021. Those are the hospital-acquired condition reduction program, value-based purchasing impact program, and then the quality program measure trends. The hospital-acquired condition program is modeling the potential impact to your facility on the, obviously the inpatient hospital-acquired condition reduction program. It's very chart-heavy, so it shows where the hospital is on a spectrum. And then there's also an exposure estimate of kind of what the penalties may be based on where you are in comparison with the hospital-acquired condition program. Value-based purchasing, very much the same. It's got a breakdown by domain as well as measure. It's all, again, based on fourth quarter data and is related to the inpatient hospital value-based purchasing program. Again, it's based on kind of a slope and ranking system, so you can see that. Both of those are very, very, very detailed reports that really drill down into each domain, each measure, and things like that. So there's a financial measurement and aspect to each one of those, so you kind of see what your exposure is. The last one, that quality program measure trend, that's really taking all of the different quality programs that are out there, value-based purchasing, readmissions, hospital-acquired conditions. If you're part of a complete joint replacement demonstration project, it's in there. And it's also thrown in with the HCAP scores, things like that. What that one is done is shown as a ranking system. So it'll show you against the state, you against the national, deciles and averages, so you kind of know where you fit in between. But all 3 of those are very detailed, 15 to 20 page reports with a lot of different domains on there, but it is very accurate and timely from Q4 data. The other 2, in fact, I'm going to open this up to everyone so we can get your opinions on these. So the Medicare cost report model that we also get from fourth quarter data, and then the Medicare margins analysis, which is fourth quarter data. The cost report model is actually a comparison of year over year from your cost reports from your fiscal year 16 through 18. If you've got, we did figure this out, if you've got a, what was it, a September, if you got a September year end, you're only going to have 2 because it's always, for whatever reason, the report books it down into that year. So you're actually in 19 at that point, not 18. So it's only showing 2 years for you. It's just a little quirk with the federal data. But it gives you all of those different comparisons year over year, again, for 3 years for the majority of you. It gives you utilization, inpatient, outpatient, uncompensated care. It's the S3, it's the S10, it's all of those different worksheets as part of the cost report. The margin analysis, it shows a trend on your Medicare margins actually going back 10 years. So to see how much you are able to, quote, make, or your margin on each Medicare patient. It gives you your overall Medicare margin. Then it gives you one where it's excluding any sort of DISH reimbursements, and then one where it's excluding any sort of DISH or medical education reimbursement. So it's really trying to break it down as low as you can. What I want to throw out to the group for those 2 is we can actually provide that in both a PDF or Excel file. So if we gave it to you, the PDF is obviously easier to read, but it is static. All the formatting works, all of those kind of things work. But we were talking when we kind of posted those that maybe these are things that the hospitals would want to trend on since there are multi-year, it is Excel-based. It really is just comparing yourself to yourself. So you could, in effect, cut and paste some of those items in each one of those worksheets and trend you know, what you're doing, what that looks like. I know everybody that does a cost report, they do it. It's a pain. They probably don't go back and look to see how much variation there was from a previous year. So if that's something that folks would rather have in Excel, we can provide that in Excel, and then they can manipulate it however they want. Again, it won't look as pretty because Excel, and there's some macros in there that build the report and the visualization aspect of it. But if that's something that you guys would rather have so you can manipulate, we can post it as an Excel file. So I'll just throw that out to the group, you know, how folks would rather have that information coming to them. So, or, you know, we can provide both if it's really something, it wouldn't be that hard to run in both directions. So what's your pleasure? Is that something you would rather have as an Excel that you can manipulate and trend, or a quick visual glance is all you need? Okay, well, tell you what, we'll next time we'll post both, and we'll see what folks utilize more frequently. All right, well, there's the schedule for the upcoming user group meetings. It is hard to believe we're already in March, so the next one will be April 1st. Same time, we'll have an agenda and all ready for that. May 6th, we'll have one. In May, I know we'll have several different reports. We get a lot of those that come out, so we may spend a lot of time on those. But see a chat question.
That was mine. Several people asked if I could post the question Bill asked previously about meaningful use, so I just sent that out through the chat to everyone.
Well, we'll open it up to the floor for any questions or anything like that. I'm sure some folks have to have some comments. Well, hearing none.
No, I'm sorry. I do have one question.
Okay.
Who was the point of contact if we did not receive the access email for the new website versioning?
Yeah, I'll be the point of contact. Sharifa Novoz. I think we'll post our contact information. It's right here. So email me, call me, and let me know if you've, check your spam and junk folders first to make sure you got it. Or some people got it.
What would I be looking for? Who was it from, or what can I search for in the spam?
Heidi, H-I-D-I, would be in part of that email that was sent, and then you'll see like a blue activation screen. I don't know if you want to slide. In between January 13th and 21st, so that was the week that it was sent. And you'll see that account activation screen where you'll click. It's a new URL, it's a new website, and then you'll have to, of course, you use your work email, and then you have to make up a new password when you click on that.
Okay, thank you.
You're welcome.
Any other questions? Anything in the chat?
No.
All right. Well, thank you all for joining us today, and please don't hesitate to reach out to any of us if you've got any questions or concerns. We're here all the time. So whenever, just give us a call. Our contact information is there. Otherwise, we will speak to y'all April 1st.